As part of the school's centennial celebrations, the Alumni Heritage Committee assisted the staff of the Wangenstein Historical Library to create an exhibit available to the public from September to December 2009. The display was organized into these 8 areas of historical interest. The first display windows focused on the early years. Dr. Richard Olding Beard's proposal to start a school for nurses was authorized by the University of Minnesota Board of Regents in October 1908. Dr. Beard, professor of physiology at the newly founded medical school, was inspired by early nursing leaders such as Isabel Hampton Robb to champion professional nursing education starting at the undergraduate collegiate level. Shown here is the first nursing superintendent, Bertha Erdman, appointed in 1909. She taught and supervised 5 graduate nurses and 6 nursing students who were admitted in March. This is the largest of 3 hospital houses. It had enough rooms for 25 patient beds, as well as an operating room, delivery room, kitchen, and intern room. The stairway in the house was so narrow, patients had to be carried up and down stairs because a stretcher would not fit. This photo shows 6 of the 8 graduates in the class of 1912, with Louise M. Powell superintendent. They graduated from the 3-year program with a graduate in nursing degree, the first nurses in the world to graduate from a university-based school of nursing. Louise Powell was the 2nd superintendent for 14 years, 1910 to 1924, guiding the new school on a path to success. Marion Vanier, 3rd director of the school, and Barbara Sharpless Thompson, class of 1913, co-authored one of the first textbooks in the United States about nursing procedures. It continued through at least 3 editions and was used in schools of nursing around the world. For the first student nurse uniform, the school provided students with a bolt of plain blue chambray so they could make their own uniforms or have them made. This style was used until 1934. While there were several different styles of student uniforms over the years, the student nursing cap and the graduate cap did not change. Nursing caps were discontinued in the 1970s. By 1931, there were 15 houses near campus where nursing students lived. Here in front of one of them is a probie, a first-year probationary student whose uniform included an organdy tie, half apron, and no cuffs. In the last 2 years, the cap, a straight collar, cuffs, and apron bib were added. For many years, nursing students had clinical experience in several hospitals besides the University Hospital. Those who worked at Minneapolis General Hospital and Miller Hospital in St. Paul did not live in cottages, but in the much nicer facilities of Harrington Hall and College Hall. This new graduate nurse is standing outside Harrington Hall. After persistent demands on the Minnesota legislature about the need for a nurse's home at the university, one was finally built in 1933, Powell Hall. It had rooms for almost 300 nursing students and staff, as well as classrooms, an amphitheater, and an elegant lounge. Friday afternoon teas were frequently held in the Powell Hall Lounge using this silver tea service. Shown here at a tea honoring her retirement is Katherine J. Densford on the left and her assistant Frances Lucier. Miss Densford was director of the school 29 years, from 1930 to 1959, longer than any other. She married St. Paul businessman Carl Dreves shortly after she retired. The year Powell Hall opened, the nursing students won the Homecoming Parade trophy. We still have it. Powell Hall was imploded in 1981 to make room for the new hospital. One of the few things left of Powell Hall is its cupola, now an architectural feature in Deal Plaza near its original site. As president of the ANA, Katherine J. Densford was instrumental in the formation of the U.S. Cadet Nurse Corps. In July 1943, Congress established the Corps to meet the nursing needs of both civilian and military populations during World War II. The Corps created an opportunity for minority students to become cadet nurses, including Native Americans, African Americans, and Japanese Americans. Ideas for the Cadet Nurse Corps uniform were sought from the best designers in the country, and Edith Head, a Hollywood designer, was the winner. The uniform was of gray flannel with red trim. The Maltese cross was on the left sleeve patch. Shown here is Lucille Petrie Leone, University of Minnesota School of Nursing faculty member who directed the United States Cadet Nurse Corps. In 1944, 96,000 cadets in all of the United States were simultaneously inducted through a nationally broadcast radio program originating in Washington, D.C. and carried in the Twin Cities by KSTP. 1,500 nurse cadets from throughout the state of Minnesota were inducted that day in Northrop Auditorium. University of Minnesota School of Nursing was the largest cadet training center in the country. Cadets pledged to stay in nursing for the war's duration. As students, though, they had immediate gratification getting into movies free, just like the GIs if they wore their uniforms. From 1917 to 1918, in response to World War I, the School of Nursing trained 300 U.S. Navy corpsmen. They were given intensive training in selected nursing skills to provide basic care on ships where no women were allowed. The school initiated the first public health course in 1918, and the program grew to be one of the largest in the nation. This bag was used by undergraduate students during their rotation in public health nursing. These nursing students were visiting a power plant in Glencoe during their rotation in rural nursing. It was a program in the undergraduate curriculum from 1943 to 1963 to encourage students to work in rural hospitals. After World War II, there was increased demand for healthcare workers. In response, the school developed a demonstration program in 1947 for preparing practical nurses who could assist professional nurses. Soon, many PN programs opened throughout the state, and the program closed in 1967. Students in the one-year program wore the cap, shown here, marked PN. When they graduated, the cap was marked LPN, Licensed Practical Nurse. Pictured here is Joanne Ruiz Bueno, the first to receive a PhD in nursing from the school. The doctoral program, begun in 1983, was the first and still the only nursing PhD program in the state of Minnesota. Pictured here are 3 American Indian master's degree nursing graduates honored in the traditional blanket ceremony. Their success is partly due to the school's promoting graduate studies among Native Americans in the 1990s. The school continues to encourage students from diverse backgrounds at all levels. Recently, another program was developed to provide an avenue for nurses seeking a terminal degree in advanced clinical practice, the Doctorate in Nursing Practice, or DNP. Shown here are the first recipients, the class of 2007. The Heritage Committee had fun assembling this Wangenstein suction set, invented in the 1930s by Dr. Owen Wangenstein, then U of M Chief of Surgery. Since the display was held in the Wangenstein Historical Library, the committee thought it should be included. The suction uses water gravity to create a vacuum and provide gentle abdominal suction. Its use opened the way to successful gastric surgery. In the foreground of this photo, there's a Cardex, which nursing teams used for maintaining information needed to provide nursing care. 2 alumni started this innovation in the early 1930s at the University of Minnesota hospitals. Today, the electronic health record used in clinical areas maintains the same kind of information previously held in the Cardex. Another first is the publication of Ethics for the Modern Nurse by Katherine Densford and Millard Everett in 1946. It was the first ethics book for nurses in which ethics rather than rules for behavior was described. Because the book included discussions of infanticide, genocide, and birth control, the Catholic Hospital Association boycotted the publisher, W.B. Saunders. Despite this boycott, Saunders continued to market this book. The first research center at the School of Nursing opened in 1972 with the support of a federal grant. Its director, Dr. Ida Martinson, launched her work on care of the dying child at home before the term hospice care was known. A more recent result of nursing research is the discovery by faculty member Diane Treat Jacobson that arm-only aerobic exercises can reduce leg pain caused by peripheral arterial disease. In 1969, Marie Manthe developed primary nursing from a research study at the University of Minnesota hospitals on Station 32. This well-known delivery system for organizing patient care, described in her book, The Practice of Primary Nursing, has been translated into 5 different languages, all shown in the display. This record book holds the meeting minutes of the University of Minnesota Nurses Alumni, organized by the first class. The initial meeting was held December 20th, 1913, with one of their purposes to recruit qualified students. The Nurses Alumni also published a journal, the Alumni Quarterly, first released in 1920. This journal contained professional articles and news from alumni. Shown here is the 1921 Student Council of the Nurses Self-Government Association, which was established in 1919. It included University of Minnesota nursing students and also those from affiliated hospital schools. Now, Nursing College Board is the organization giving voice to students into the School of Nursing, as well as university-wide governance. School of Nursing students are in the forefront of state and national student nurses organizations too. Shown here is Phyllis Halverson. She was president of the National Student Nurses Association in 1954. The 1931 Gopher Annual has this picture of the Beta chapter of Alpha Tau Delta. It started in 1927 as a fraternity for 5-year nursing students with the purpose to develop leadership skills and foster community service. It is no longer active. In 1934, Zeta chapter of Sigma Theta Tau, an international nursing honor society, was founded at the University of Minnesota School of Nursing. On the right is a Sigma Theta Tau pin. On the left is the School of Nursing pin given to students when they graduate. The School of Nursing Foundation was started in 1958 by Katherine J. Densford to raise funds for research, education, and scholarships. During the centennial kickoff, they presented a check for $1 million to establish the School of Nursing Foundation Endowed Research Professorship. After World War II, student nurses donated their U.S. Cadet Nurse Corps uniforms and textbooks to schools of nursing in other countries in Europe and Asia. In addition, students raised money to pay for some of the shipping costs. Here are some French nurses at the School Florence Nightingale in Bordeaux, wearing the donated uniforms from the School of Nursing. One section of the display focused on the partnership with Seoul National University School of Nursing, initiated in 1954. The relationship involved exchanges of faculty and hospital nursing administrators. In 1959, Seoul National University faculty expressed their appreciation for this assistance by presenting a vase to the school. The relationship between our schools continues. In 2007, Dean Connie Delaney was the keynote speaker for the centennial celebration of the Seoul National University School of Nursing. In Iceland, Dean Delaney held a professorship in nursing at the university from 2001 to 2004 and continues her association there. Her work led to the International Partnership in Nursing and Health Informatics, involving the University of Iowa, University of Iceland, University of Oslo, Norway, and the Örebro University in Örebro, Sweden. The school has global involvement in the Southern Hemisphere, too. This 2009 photo of junior student Sarah Tomzik during the time she did public health nursing coursework in Ethiopia. In closing, these photos, artifacts, and information were part of the centennial display viewed by hundreds of alumni and friends at the Wangenstein Historical Library. The exhibit ran from September through December 2009 to mark the 100th anniversary of the University of Minnesota School of Nursing's founding in March 1909.